This video is sponsored by Mahalakshmi Jewelers, United Diagnostics, KBN University, Nusan Fabrics Clothes Store, Surat Khazana, Chulbul Lighting and Furniture, and by S-Mart Super Bazaar. डीसी वी.वी ज्योत्सना ने एक्सक्लूसिव गोहाश से बात करते हुए बताया कि किस तरह से कोविड-19 के अंदर अनलॉक 2.0 हो रहा है और क्या-क्या तैयारियां उन्होंने की। उन्होंने ये भी कहा कि थर्ड वेव के बारे में उनका क्या ख्याल है।
Lockdown is bad for the economy. Lockdown is bad for the livelihoods of the people, bad for the families and all that. But we had to take certain tough decisions because COVID was an immediate threat. It was a calamity.
उन्होंने ये कहा थर्ड वेव के बारे में सबसे बड़ा अहम रोल है जनता का, जहां पर अगर वो मास्क और सोशल डिस्टेंसिंग मेंटेन कर सकते हैं और कोविड अप्रोप्रिएट बिहेवियर वो मेंटेन कर सकते हैं तो ये बीमारी वापस नहीं आ सकती। उन्होंने ये भी कहा कि हमने सारी तैयारियां कर रखी हैं, चाहे वो हॉस्पिटलाइजेशन के बारे में रहने दो या फिर किड्स के बारे में, क्योंकि थर्ड वेव में अक्सर बताया जा रहा है किड्स का मामला बहुत अलग होने वाला है, काफ़ी एफेक्ट होने वाला है। उस पर भी उन्होंने कहा कि हमने सारी तैयारियां कर रखी हैं।
When the third wave will come and how hard it is going to hit Gulbarga depends on only one factor, that is the discipline that people of Gulbarga are going to have. How responsibly they behave, how frequently they reduce the social gatherings, and many factors which are just behavioral. Augmenting the healthcare setup, training the nurses and getting the medicines which are required or procuring pediatric ventilators, all these are last mile efforts in COVID containment. And for this, we need everyone's support and everyone's cooperation so that we can prevent a third wave of COVID. Even if that hits us, we should be able to contain it. All the private hospitals with more than 100 beds are advised to have their own oxygen generation plans. And we had a meeting with the Pediatric Association and also IMA, and 7 pediatric hospitals have been identified which will be designated hospital for pediatric COVID care. And we are talking to other pediatricians also. We have an expert committee in Gulbarga right now to deal with this pediatric side of the COVID-19 treatment. We as an administrators are happy that we could effectively control COVID to a certain extent, that economic activity in our district could take off. This gives livelihood guarantee for many people, and it gives access to livelihood for many for whom during lockdown there was a lot of difficulty. Though this brings a lot of respite to the people whose livelihood is at risk and the families which were locked down for a long time, everyone who is coming out for their job or there for shopping or just to mingle with friends and the family, please stick to COVID appropriate behavior. Wear mask all the time when you are in public spaces and maintain your hand hygiene, and please maintain social distancing. These things are very, very vital in protecting ourselves and our people from COVID-19. And all the people who are eligible for vaccination should get vaccination. Yesterday, in fact, in our city, 10,500 people got vaccinated in one day. And in one day, entire district, about 38,000 people have been vaccinated. Vaccine, along with COVID-appropriate behavior, can stall and contain the third wave. Because we could see third wave coming in some parts of the world. And we had very bad experience during the second wave. So we need to be mentally prepared for third wave. So we have augmented our healthcare setup during the last 2 waves, first wave and second wave, with an adult-centric approach because mostly the adults are getting affected. Now we have to augment our resources and infrastructure to treat the pediatric cases. So we have been working on 3 verticals. One is preventive, another is clinical, and third wave is childcare. Third vertical is childcare. So in the preventive side, we are procuring the medicines, especially the multivitamins for malnourished children. We have identified all the malnourished children in the district. And severely malnourished children are brought to the NRCs for treatment, and now this treatment and this special drive is going on everywhere, including the city and even remote rural areas. It's not just the behavioral aspect. When we look at that, even the access to the junior size mask is very limited in the market. For that, we are getting junior size masks for children and this issue has been discussed at state level also. And in fact, our police training college in Gulbarga has procured child size masks, and these have been distributed in some of the areas, more vulnerable areas in Gulbarga city. On preventive side, we are taking care of this and also creating an advisory and distributing this among the parents of the children who are most vulnerable for this COVID-19. On a clinical side, we are augmenting the bed strength in taluk hospitals. We are increasing it to 100 oxygenated bed capacity with 30 bedded pediatric wards, including 5 bedded ICUs for children. And what we have seen in second wave, one of our toughest lessons was that we can't depend on external sources of oxygen. When we had issues in the second wave, we could ramp up our production capacity, and we have increased our local oxygen production. That could sail us through the second wave comfortably to some extent. This time again, we should be able to produce our own oxygen within our district boundaries without depending on the external sources, because there will be always some kind of uncertainty when we depend on external sources. All the private hospitals with more than 100 beds are advised to have their own oxygen generation plans. And we had a meeting with the Pediatric Association and also IMA, and 7 pediatric hospitals have been identified, which will be designated hospital for pediatric COVID care. And we are talking to other pediatricians also. We have an expert committee in Gulbarga right now to deal with this pediatric side of the COVID-19 treatment. And another aspect, another vertical we are working on is childcare. During second wave also, we have seen, and one of the parent is in hospital and the other parent might be attending to the patient, or sometimes both the patients are in hospital too. So childcare is one of the critical cases, though the child is not positive. When the caregiver is in hospital or attending to someone who really needs care, we are planning to establish temporary care homes for children, where the parents can drop the children off in the morning and pick them up in the evening. Also, if they want an extended stay, for example, if they are in hospital and until they get discharged, they want their children to be in a safe environment. For that also we are making arrangements, and we have tied up with the Art of Living Foundation for this, and building has been identified, and all the teams are ready for this. And as and when it is required, we will put them into use. But we hope will not get into that stage where we will have to use all the capacities that we are creating. And this is the way we can protect our people. This is the way we can protect our children. And hotels and restaurants, when they are non-AC, they are allowed to operate for dining with 50% of capacity up to 5 p.m. And earlier parks were open only till 10 a.m. Now they will be open till 5 a.m. From 5 a.m. to 6 p.m. for walking and all that. But no group activities like group yoga or laughing club. Those we used to have that kind of group activities that cannot be conducted right now. Non-AC are open, but air-conditioned gyms are closed. Skill training, especially in healthcare sector or solid waste management, are permitted. Rest of the skill trainings will be permitted later on. Earlier we used to give 6 a.m. to 10 a.m. Then it has been extended to 6 a.m. to 2 p.m. Now the essential and non-essential, everything can operate from 6 a.m. to 5 p.m. adhering to COVID appropriate behavior. If someone is trying to enter a hotel or a shop without a mask, it is not just a responsibility of the individual, but also the responsibility of the shopkeeper. When our teams come there, if we see anyone without wearing a mask or not maintaining social distancing in a shop, we'll take strictest measures against that commercial establishment.
This video is sponsored by Mahalakshmi Jewelers, United Diagnostics, KBN University, News and Fabrics Clothes Store, Surat Khazana, Chulbul Lighting and Furniture, and by S-Mart Super Bazaar.